Hey everybody, this is Joshua, the tendonitis expert. And this video is about Achilles tendonitis surgery stories. And unfortunately, it doesn't always work out like you wanted it to. So on my website, there's a page, Achilles Tendonitis Surgery Stories.html, where there's a large gathering of people's surgery stories. How it went, what they experienced, did they recover, did they not recover, with variations from either extreme there. As well as lots of good tips and info like, you should get a knee scooter, because knee scooters are way better than crutches and it just makes life easier. And you're probably going to need something like that. So again, and I'll point to this again, and there's a link underneath the video. Achilles Tendonitis Surgery Stories is the page. Lots of information there if you are considering looking at getting Achilles tendonitis surgery or you've already had it. So let's talk a little bit about some things. So Achilles tendonitis surgery normally does not result in this big of an incision. These days, they just make a couple little holes, they put in some instruments, and quote-unquote clean up the tendon from there. This big incision here is more from Achilles tendonitis rupture, where they have to visualize it. They have to do a lot of work in there. So a big incision is not uncommon for rupture, but is uncommon for just tendonitis surgery these days. Even for a quote-unquote minor tendonitis surgery on the Achilles, you're probably going to end up in a boot at the very least, you're probably going to end up in a cast, at the very least a soft cast. Because what they're doing is, imagine this is your tendon and not your skin, they're getting there and they're injuring your tendon. They're cleaning up, they're shaving off, quote-unquote, any bad stuff that they see, and hopefully only bad stuff if they see it, and they're hoping that triggers new tendon growth. Stimulate some new growth for quote-unquote healthy tissue, which is all great, but it's still an injury and you're going to need to be immobilized for a while just as you heal from the actual injury. Let's talk about Achilles tendonitis surgery itself for just a moment. I'll briefly do that elsewhere. But for Achilles tendonitis surgery, they're going to make a couple holes, they're going to put a couple instruments in there, and they're going to look at the tendon and hopefully they think they'll see some scar tissue, some degradation. So they're going to clean that up. They're going to shave it off, and then they'll have nice, clean, white tendon tissue, and hopefully that will heal more good tendon tissue, and then it'll be stronger, and that will get rid of the problem. And that's not so bad, except that it's A, a trauma, and B, it totally ignores the actual causes of your pain right there. If you have pain right there, that in no way means that right there is the problem. And in almost all cases, it means it doesn't mean, but it's correlated with it's not actually the problem. And that's because of how tendonitis works. I've repeated this elsewhere. Tendonitis is a dynamic. And it's made up of multiple factors. 3 factors primarily: muscle and connective tissue tightness, inflammation process, and nutritional insufficiency. All this muscle gets tight, it pulls the tendon that way, which puts force on the tendon, pulling that way, force on the attachment, the heel, and that causes pain and problem eventually. Part of that pain and problem is inflammation process, which releases chemicals which enhance your sensitivity to pain. That makes everything hurt. That tells the brain there's a problem, and the brain, bless its heart, tries to protect you with more tightness, which creates more force going that way, which creates more pull on the tendon, which creates more irritation, inflammation. All along the way, nutrition is getting used up. Tight muscles use up nutrition. Inflammation eats up nutrition. That leaves you short. That leaves the muscles not being able to relax. And it's just a big downward spiral of more pain, more tightness, more pain, more tightness, more pain, more tightness. You end up having pain in one spot. The doctor tells you that that's the problem. The doctor ends up doing surgery after rest and anti-inflammatories and physical therapy. After that all fails, doctor says, well, let's do surgery. I'm 0 for 5 so far, but let's do surgery, because that'll do it, we hope. They do surgery, and maybe it'll help. I certainly hope so. If it doesn't, it didn't hurt because it totally ignored the muscle and connective tissue tightness pulling on the tendon. It totally ignored the inflammation process, the cause of the inflammation process, and it totally ignored the nutritional insufficiency. That's most often why Achilles tendonitis surgeries, quote-unquote, fail. Sure, sometimes the surgeon will nick a nerve or various other bad things happen and you end up in a way worse state, but generally the surgery just doesn't really work because it ignores the cause of the pain. And it makes sense that if you have a nail sticking in your forehead, you can do all sorts of things like icing and rest and physical therapy, but if you don't remove the nail, it's going to continue to hurt. Same thing here. This pain in your Achilles, whether it's there or around your heel or anywhere else, ultimately is from the dynamic, and that's how you get rid of it. So to find out more about people's experiences with Achilles tendonitis surgery, visit my website, www.tendonitisexpert.com/Achilles-tendonitis-surgery-stories.html. There's a link below the video. And of course, I always recommend my program, Reversing Achilles Tendonitis, if you want to get rid of the problem. Also, if you've had surgery on your Achilles for tendonitis, please go there to that page and share your story. The bigger the collection of results, the better.